vaccination of funeral home employees and mental health clinicians. Dr. Bennett and the local health directors will go into more detail, but as a general overview, the Finger Lakes Regional Hub, which is at the University of Rochester Medical Center, is responsible for the coordination and distribution of the vaccine in Monroe County and throughout the region. So far, we're in phase 1A, which is largely nursing homes and long-term care facilities, which are being handled and managed through the federal partnership with the federal government and with healthcare providers, which is being administered and handled in coordinated hubs and the hospital systems. Here in Monroe County, we are working closely with our hub to assist with those vaccination efforts in the current 1A phase, and then to be able to scale up our efforts as we prepare to vaccinate larger and larger groups as we move through future phases. Our public health department is currently operating 2 vaccine pods for targeted individuals within the approved phases. Just last week, we began vaccinating nearly 2,000 EMS personnel at Monroe County Fleet Center. We've ramped up to a pace where we can vaccinate roughly 500 a day and anticipate completing EMS personnel this week. We are then going to use the site to begin the vaccination of additionally approved groups, beginning with independent mental health clinicians in other sectors. I know there's a lot of questions about how many people to date have been vaccinated in our community. And that's a very difficult question to answer because not all of the vaccines that are administered are reported to Monroe County. They're done through the federal partnership with the nursing homes and long-term care facilities, or it's done and reported through New York State, which then we don't have the full context of the numbers. But what I can tell you is the numbers that we've been able to get. To date, we are estimating through the 2 hospitals in Monroe County, between the 2 hospital systems in Monroe County, that roughly 20,000 vaccines have been administered just by the 2 hospital systems. In addition, the Monroe County Department of Public Health has administered roughly 1,200 vaccines at our pods. And then on top of those 2 numbers, the 20,000 to 1,200, on top of that are the nursing homes and long-term care facility vaccinations through the federally qualified health centers and others who are vaccinating this community. So it's not a full reflection of the full number that have been vaccinated, but it's what we can share with you to date. While we know that the number does not yet include what's happened at local nursing homes and long-term care facilities, we can tell you that as part of that federal effort, Monroe County's nursing home and Monroe Community Hospital has begun its vaccination effort this week, working in partnership with CVS. Yesterday alone, we had 200 residents at Monroe Community Hospital vaccinated and about 20 staff members. The plan is to continue the vaccination of our residents today, with the remaining of the staff being vaccinated tomorrow and Thursday of this week. Phase 2 of the vaccination clinic at Monroe Community Hospital will be held the last week of January. As I said before, Dr. Bennett and Dr. Mendoza and Director Beer will detail more specifics about the vaccination plans, distribution of the vaccine, and the local health department's role in the effort. So with that, I'll now turn it over to Dr. Nancy Bennett.
After 10 months, I'm still forgetting to unmute. Good afternoon, everyone. Thank you, Adam. It's really a pleasure to be here today, and we're sort of kicking off our intention to have frequent and in-depth communication with the community. It's taken a couple weeks to get up and running, but we hope that we'll be able to communicate with you on a very regular basis. As Adam mentioned, the University of Rochester Medical Center was asked to be a hub for the New York State vaccination effort. These hubs are established in 10 medical centers across New York State, and each one of those hubs is responsible for a certain region. In our case, we're responsible for the Finger Lakes region, which includes Monroe County and the surrounding 8 counties, so a 9-county region. This is the same region as the Finger Lakes Economic Development Region, and that's the basis on which these hubs were established. The purpose of these hubs is to really coordinate the vaccination efforts in these regions. So typically, much of this kind of work is done by public health. And this time around, it was felt that we really needed to engage the hospitals up front because the first population to be vaccinated were hospital workers. So as a result, there was sort of a little bit of a disconnect in the very beginning between public health and the hospitals. And the purpose of the hubs is to really connect the two and to ensure that all of our efforts across the whole region are coordinated and efficient. Our hub is particularly focused also on ensuring that we can have full equity in the way that our vaccination is distributed to our community, as well as full transparency as we move through the stages that Adam referred to. These stages are based on the recommendations of the Advisory Committee on Immunization Practices, which is an advisory committee to the Centers for Disease Control. And we are following them quite strictly in New York State. You undoubtedly have heard about other states where they are taking a different approach, but New York State has decided to go with these recommendations. And they result in there being several phases of vaccination. And those phases, as Adam mentioned, are beginning with those who are at highest risk due to their work in the healthcare professions. So 1A, which is what we're in right now, includes all patient-facing healthcare providers. And that means anyone from the person who checks you in at your doctor's office, to the person who washes the floor in the patient's room, to the doctor or the nurse who's caring for a patient. And so our hospitals have gotten off to a fantastic start, have gotten many of their staff that are most at risk vaccinated in the last week or so, and are now expanding to do more of the community physicians' offices, as well as other healthcare workers, such as dentists, physical therapy, et cetera. Phase 1B, which we will move into at an indeterminate time, includes essential workers other than healthcare workers, and also patients who are over the age of 75. We don't know when phase 1B will start, but many of the questions we're receiving are from people who are in 1B, and we can assure them that when it gets time to do 1B, we will be very clear about that. 1C consists of people who are between the ages of 65 and 74, and those who have chronic conditions. In other words, anyone over the age of 16 with chronic conditions. Again, we have no idea when we'll get to 1C, but that's what follows. And then phase 2 really is being used for people who don't get done in phase 1 for some reason, and also for some critical populations that may have been missed. And then finally, phase 3 is the general population over the age of 16 and under the age of 65. So those are the phases, and we are going through them very intently. Each week, New York State focuses its attention on particular members of those larger groups. So initially, we really just started with hospital workers, but now it is expanded to include a number of other kinds of healthcare workers. And in order to provide vaccine to these groups, we are starting to use all different venues and all different groups. So the hospitals are still very much engaged and will continue to be. FQHCs have been providing vaccine not only to their staff, but also to some additional staff. The health departments in each one of our counties are all up and running and are starting to provide vaccine to critical workers in their areas. As we move into other stages, there will be more and more different kinds of people providing vaccinations. So we're trying to do this in a really systematic and a really inclusive manner. I think it's really important that people understand that this is well planned out, that it's something new and different that we have never done before, at least not in my lifetime, and that we're learning as we go. things change rapidly. We try to make adaptations to those changes as quickly as we possibly can. We do not have all the answers at this time. We're really putting the plan together as we go, but all of the pieces are in place. We have an incredibly robust community throughout this region that is definitely able to implement this vaccination plan. And I feel completely confident that we'll achieve our goals. It may be bumpy, it may be ugly, it may take longer than we hope, but we will get there, and everyone in our region who wants to be vaccinated will be. I'd now like to ask Dr. Mendoza and Ms. Beer to talk a little bit about the specific on-the-ground experience that the county health departments are having. This is really challenging for everyone, but it's been really incredibly wonderful to work with the health departments and to realize that they have such incredibly robust plans in place. Mary, do you want to start?
I do have to remember to unmute. Thank you. Good afternoon. Thank you for the opportunity to share a little bit about what's going on in the rural hospitals and the rural communities. This is the first week that the local health departments outside of Monroe is receiving vaccine, and we're actually getting up our pods, our point of dispensing clinics, and actually delivering that. We're also coordinating with the hospitals and finding out what pockets are out there that they haven't been able to vaccinate, and then trying to make plans to make an outreach to those individuals. I would say that it is our first week, so we're hitting the ground running. Many of our pods are going to be drive-throughs. And I do want to emphasize that this is not our first rodeo in terms of delivering vaccine in mass clinics. However, what is unusual is just at such a grand scale. And so it's really been wonderful to see that the years of planning and the regional planning that we've done and the partnerships that we have developed over the years is really helping to put the plans together and get this rolling out. I just would ask everyone to be a little patient because vaccine is a little slow in coming, as we'd love it all to be here to be able to do everybody all in one day. That's not possible. So we will do our best to make sure every single vaccine that we get in the door gets out the door and in someone's arm.
And thank you, Mary and County Executive Bello and Dr. Bennett, for your partnership and for all of your long hours of work, especially through the holiday, to help figure out this immense challenge on behalf of our community. Our state and county public health departments are set up to respond to situations just like this. We have spent our careers training, planning, and envisioning the processes and procedures to follow in times like this. There are a lot of pieces in place, and I believe we are as prepared as we can be. But there are, however, many, many factors that affect the actual implementation of these plans. What kind of vaccine and how much of it are we getting? When will it arrive? Where will it go? Who will administer it? Who should get it first, second, and third? Those are just a fraction of the questions we are working with our state and local partners on day and night to resolve. Our basic plan has to continually evolve as new information, new resources, and new staffing become available. We understand that we do not have all of the answers that people want right now. We understand that it is not going as fast as anyone would like, including myself. But please know that we are chipping away at this and systematically going through the vaccine as it arrives using the recommended guidelines. When you are available to receive the vaccine, I promise you, you will know it. With support from many people across the community, we will let you know when and where and how. I promise you, you will not miss out. We do not want anyone to miss out on this opportunity who wants to get the vaccine. So I again want to thank everyone for your patience. We want to get back to normal. We want our businesses and our schools fully open. We want to revive our social connections and we want to travel. All of those things will be possible again. But first, we have to carry out what I've long called the largest public health undertaking of our generation. And so with that, I want to turn it back over to the county executive and we'll take your questions.
Thank you, Dr. Mendoza, and thank you again to Director Beer, Dr. Bennett, for all of your work, particularly over the holiday. weeks here, the last few weeks. A couple of things I just wanted to talk about before we open up the questions. First is that just a few weeks ago, Dr. Mendoza and I announced the creation of the Finger Lakes COVID-19 Vaccination Task Force, which is being led by Dr. Bennett and Wade Norwood from Common Ground Health. This group is charged with ensuring our core principles of equity, transparency, and fairness and distribution of the vaccine will be met. They will also work with community groups and residents to provide answers to questions that exist so everyone can make an informed decision on whether or not they will take the vaccine. Achieving this level of vaccination is necessary in order to move this community beyond the pandemic is going to require an unprecedented level of coordination, education, and communication. The task force is going to work hand in hand with the regional hub to ensure that this is accomplished. We're not naive to the fact that there really are a lot of questions and concerns surrounding the vaccination, and that is why we are taking these proactive steps to ensure that the process is done correctly and that we're putting the community's resources behind it. And that is why we convened this task force and why we're going to engage in constant communication about where we are, even if we don't have all of the answers. Also, it's been nearly 10 months since our first case of COVID-19. This community over the last 10 months has come together in ways like we've never seen before. We've had nonprofit groups, government leaders, the healthcare systems, and individuals across this community working together to slow the spread of the disease and also to work together to support each other, support those who are sick, and to support those who are struggling economically, support our students and teachers throughout. And while the finish line is on the horizon, the vaccination process here is going to take some time, and so patience is required. It's not going to go as fast as any of us want it to go, but I can make a commitment to this community, and so can the leaders on this call, on this press conference, that we are going to work and do everything that we can to make sure that as the vaccine comes out, it gets distributed into people's arms. We need everyone here, though, over the next several weeks and months, because it is going to take time to dig deeper, to understand what it is that worked to slow the spread, to lower the curve, flatten the curve, and save lives in our community. It's wearing our masks, it's socially distanced, and it's washing our hands. We know what to do. We've done it before, and we can do it again. Our numbers here, in terms of our positivity rate and our hospitalization numbers, remain too high. We need to work together to bring those numbers back down. There's a lot of reasons why I think we're higher than other communities across the state are right now. And I think one of the biggest factors is that we are victims of our own success. We have kept our numbers very low throughout the beginning stages and last summer of the pandemic. And because of that, those who are susceptible to catching the disease did catch it right away. And now we're playing catch up. But our future is in our hands. What our community looks like 2 weeks from now, 3 weeks from now, 4 weeks from now is almost entirely dependent on the actions that we take today. And like I said earlier, we know what works. We know that wearing our masks work. We know that keeping socially distanced works. We know that washing our hands works. So I'm calling on this community now to double down in our efforts, double down on what we know works, but also double down on protecting each other and working with our community to make sure that those who are at most risk of a severe consequence for the disease have their needs met. Do you have an elderly neighbor who needs help getting groceries but shouldn't really be at the grocery store right now? Do we have family members who are struggling economically? Do we have children who are struggling educationally that we can reach out and help? That's what we should be doing. We should be coming together as a community right now to get through this, because the consequence of failure are too great. The hospital systems, as you saw yesterday, are becoming overwhelmed. They're filling, and we need to provide help, and there are ways to help the hospital systems. The way to help is prevent getting sick. So we have to work together to prevent the hospital systems from becoming so overwhelmed that they can't keep up with the cases that are coming in. That is our job. The healthcare systems, the doctors, the nurses, the techs, all those who are working inside the healthcare system and inside the hospitals, they're doing their job. They're treating us who are sick, and they're protecting our families. And now we do our job, which is to keep the spread as low as we can so we don't have so many people going into those systems. So let's work together to get that done. With that, we'll open it up to questions about the vaccine.
Okay, thank you. First up is Brian Sharp from the Rochester Democrat and Chronicle.
Thank you. I was hoping that maybe Dr. Bennett could elaborate a little bit on the timing of the rollout to the next group of folks, and how people will be notified, or if they're supposed to call and sign up, or if you can talk a little bit more about this next step process. I'm hearing a lot from folks who are not affiliated with hospitals and trying to figure out how they get in line.
Thank you for that question. The timing of the next step is very unclear. We still have a lot of healthcare workers to vaccinate. So 1A is actually a pretty big group of people across the region. Between long-term care facilities and healthcare workers, it amounts to about 100,000 people. So from what you've just heard today, you know that we have a long way to go in 1A. What the criteria will be for moving to 1B is not entirely clear, because again, we haven't done this before. But I would anticipate that it will be weeks before we move to 1B. It could be 2 weeks, it could be 6 weeks. I really can't give you that answer. When we do move to 1B, it is likely that a tremendous amount of the vaccination will be delivered through public clinics. We're looking at essential workers, who are the people who keep everything going in our society. And those people are probably going to be best identified by their employers and by working together to figure out who is essential and who can wait a little longer. Also in that group are those who are over the age of 75. And it's likely that those groups will be done by the hospital systems. So people who have a doctor in a particular hospital system will likely go to those hospital systems to get their vaccine at that time. But again, we don't know when we'll be in 1B, and we don't have every kink of how we're going to get people in to get vaccinated worked out. There is a state system currently for making appointments, which we're at the moment not using for a variety of reasons. We will also probably have a local website and system so that people will be able to make appointments easily for local clinics when they are announced. And we will loudly announce when we are in 1B and who we're looking at in 1B and who will need to be vaccinated during 1B.
Brian, did you have a follow-up?
Yeah, I'm just wondering, and maybe I wasn't clear. With 1A, my understanding is that does include some medical personnel not affiliated with hospitals, I think funeral directors, et cetera.
Yeah.
When is that happening, and how do those folks get access?
That's starting now. Employees at the hospitals have been being vaccinated for the last couple of weeks, as you know. Non-employees and non-affiliated healthcare workers in the community are starting to be vaccinated now, both by the health department and by some of the other groups in the community, the hospitals and the FQHCs. We, for example, with physicians' offices, we essentially asked those physicians who belong to a network, such as Accountable Health Partners or GRIPA, that they work with their network, and then the hospitals are going to vaccinate those offices. So that took care of many, many members of our community. However, there are plenty of independent physicians' offices, and so we've been working very closely with the Monroe County Medical Society to bring those physicians in, and their vaccination will be starting later this week.
Thanks, Brian. Next, we have Wendy Wright from Spectrum News.
Yeah, thank you for taking my question today. Wanted to ask you, and I don't know if this is best for Mary Beers or Dr. Mendoza or Nancy Bennett. We have so many smart people on this call today. How you are deciding which nursing home is getting the vaccination first. I've heard from families who are concerned because their relatives have not received vaccinations yet, and they're hearing that other nursing homes have received the vaccine.
So I can answer that. The nursing home program, and this is, we're talking about skilled nursing facilities and assisted living facilities, not independent living facilities. So it's just the first two that are part of this program. They are mostly part of a federal program that is a partnership with Walgreens and CS, and the nursing homes or assisted living facilities have signed up with those entities. They've chosen one or the other, Walgreens or CVS, and they are receiving vaccines through those pharmacies. The scheduling of that was completely left up to the facility and either Walgreens or CVS, whichever they're contracting with. And we sadly don't have a lot of visibility to that scheduling or that plan. It's really been a federal plan. New York State, I think, has a little more visibility, but we're still waiting to get information about the scheduling and exactly how many people are being vaccinated. So it's going to happen over the course of the next several weeks, but it is kind of one by one, and we don't know exactly, you know, there's no rhyme or reason as to why one nursing home went before another.
And another question I have is there's been some concern about the Bills game, and as great as this is, the Bills finally getting back into the playoffs after all these years. There's so much excitement with them having such a great run. There has been some concern about that potentially being somewhat of a super spreader, and also some backlash from Voices for Seniors and from the restaurant industry about that, about the prioritization of this. And as exciting as this is for the Bills and Bills Mafia, is this something you're concerned about as being a top priority right now? And what do you say to the people who are concerned about this?
That's over my pay grade. I'm going to leave that to the county executive.
Well, what I would say is this, you know, and I'm a Bills fan myself, and disappointed that this season we couldn't make it to any games. What I can say is, in terms of being a super spreader event, I have to trust the health professionals and their testing strategy to make sure that people are safe, and that it doesn't contribute to the spread of the disease throughout the community. I would ask anybody who's going to the game from Monroe County to take all the precautions that we consistently offer at these briefings. Wear your mask. Do not take your mask off if you attend the game. Stay socially distanced from those who are not part of your household, and make sure you're engaging in good hygiene practices while you're there. I think that's what the ticket system was set up for, and how they're organizing people around the stadium. So please follow those rules. I know we're all very excited. I couldn't be more excited that the Bills are in the playoffs, but we do have to follow those regulations and those rules. No Monroe County resources are part of supplying any of those test kits or anything like that for the game. We have really been focused on shepherding every resource that we can find into our community testing. I didn't mention that earlier in my remarks, but we're still doing rapid testing free to the community here. We're doing thousands of tests a week. There's more appointments available on our website at monroecounty.gov at all our testing locations throughout the county. So I would encourage you, please, if you're here in the county and looking for rapid testing, we have testing available. We also do walk-ups. If you didn't have a chance to make the appointment, we make every effort possible to get to every walk-up individual who's there. So we have free testing available. And now we're transitioning our efforts into working with the hub to supplement their efforts with our pod system, and then putting plans in place to grow that pod system as the availability of vaccine continues to grow. We want to make sure our job in Monroe County is to make sure that the distribution network of the vaccine as it arrives, that we are helping to meet that need as it grows, so we can get those shots in everyone's arms.
If I could build on that, this is Mary Beer, and I would also say that I'm not just concerned about the actual event, which is very exciting, and they're taking so many precautions, but I'm really concerned about what's going to be happening locally. As we've seen such a high surge at Christmas time, I'm concerned again that people will be gathering to have Super Bowl party, or not Super Bowl, but then 2 Super Bowls coming, and hopefully the Bills will be there. However, I'm really concerned and really recommending, please be careful. Please just stay within your small group.
Thank you.
Thanks, Wendy. Next is Mike Hibbert from the Finger Lakes Times.
Yes. Thanks for taking my question. I guess I have just a general question. What is a person, the average Joe, so to speak, like myself or somebody who's older? And I'll give you an example. My parents are both above. My dad's 80, my mom's 78. They're in good health, but they don't know when they're going to be contacted to get their vaccine. Or how about somebody of that age group? What do they have to do? Sit by the phone? Do they call somebody? Do they go online? And how about for people of lesser age who are wondering when they're going to get their shot?
Do you want me to take that, or?
Yeah, Dr. Bennett.
Okay.
Yeah.
There are a couple things they can do right now if they want to get a feel for where they are in the lineup. And I'm answering this generally, not specifically for your parents. Your parents will be in 1B because that's anyone over the age of 75. But for anyone, one of the things you can do right now is go to the New York State website, which I think is New York State COVID-19 vaccine, I think, something like that. We can provide that. And that website actually has lots of information about what group you would fall into and gives lots of information about what stage we are in right now. We will also have an analogous website up and running, I hope, in another week or two that will help with that as well. People will find out because we will be publicizing that we are now in phase 1B, for example, and we will explicitly say who should try to arrange to get a vaccine. For people who are over the age of 75, it's highly likely they may be contacted by their hospital or their physician's office. For people who are essential workers, they will probably be contacted by their employer. Or there'll be a more general call for a particular kind of essential worker. But there will be lots of information out there. But right now, the best source is the New York State website.
Okay, thank you.
Do you have another question, Mike?
Mark Gruba and the News 8 studio with you. We have been listening to an update from county leaders and health officials regarding the vaccination efforts for COVID-19 across Monroe County and the Finger Lakes region as well. We will gather a full recap of this for you on News 8 first at 4 and coming up at 5 and 6 as well. And for the latest information on COVID-19, you can always head to our website at rochesterfirst.com.
Week period, it's still very important to continue to wear your masks, to take your precautions, and to be thoughtful about those gatherings that we've been talking so much about for the last 10 months.
All right, thank you. And then my second question. So earlier today, Governor Cuomo said New York State receives about 1.2 million doses per month, and we need to vaccinate 20 million statewide twice. So by those numbers, it would take more than 2.5 years to get all New Yorkers vaccinated. So, I mean, is this what we should expect? I mean, how long should we expect, I guess, locally too, for critical mass immunization?
That's a great question, and it's hard to answer how long it will actually take us to get through the 1.2 million people in the Finger Lakes region. I think one of the points you're making that's really important is that we do not have sufficient vaccine yet to vaccinate our entire population. And we are dependent on other vaccines being approved for use and being deployed in the vaccine campaign. So currently there are enough doses to get started, but not enough to complete our entire population. And that's part of the reason for the phased approach, is so that we can ensure that we cover the most at-risk people right up front. We are pretty confident that other vaccines are going to come into the marketplace. I think AstraZeneca is on the launching pad, and we should hear about it soon. And then there are additional ones in the pipeline. So we need those vaccines. It's very important. We're going to need to continue testing them and in trials, and it's very important that people continue to participate in those trials. So yeah, we need more vaccine. There's no question.
Thank you. Next, we have Kenner Jubinville from 13 Lamb.
Hi, good afternoon. I know you said there's obviously a lot of moving parts every day to figure out this process, and you expect bumps in the road and that throughout this. But can you just talk about some of, I guess, what specifically are just some of the day-to-day things that are popping up that you might be having to deal with, and some of the day-to-day challenges and obstacles to rolling this out?
Well, I'll start. The myriad of logistics is mind-boggling, from scheduling, from staffing, from all of the traffic-related concerns, getting all of the people to a particular site. With these vaccines, you have to wait 15 minutes. So you can't have too many people coming to get their vaccine all at once, because you may have to violate social distancing, have them wait in the same space. The details are infinite. And so part of the reason why we're going somewhat more slowly than I would like is so that we give ourselves a chance to get it done right and to sort of work out all of these kinks. Some of these kinks are local that we will figure out, that we've been able to work through our planning and so forth. And some of these live at a different level. So scheduling through the state system, getting the information on who's gotten the vaccine in our county is not information that we currently have access to in a ready fashion. Many of those challenges live at the state level, but we're working through all of these, and we're in constant communication all day, it seems, with all of these parties to try to answer these questions. So as these answers come out, I do think, I'm very optimistic that we're going to ramp up our vaccination rate substantially.
And kind of dovetailing off of Kayla's last question, I mean, at the rate we are going, are you confident that by the end of 2021, anybody in our region who wants a vaccine will have access to one? I mean, I know it's kind of a loaded question with a lot of moving parts still, but are you confident with the way that things are going now that could happen?
Well, there's no way we're going to be able to vaccinate the entire population if we go only at this rate. We're going to have to speed up in order to get to the finish line, which I'd like to think is sometime this fall. So it all depends, as Dr. Bennett said, on the availability of that supply chain of vaccine coming from the other manufacturers and coming from Moderna and Pfizer. So we will need more vaccine in order to step on the gas, if you will. But no, at the current rate, no, we're not going to be able to finish by the end of the calendar year. And I don't think that anybody wants to be doing this next year. We'd like to get all of this done, or as much as possible, before the end of this year.
Also, just to add to that, you have to realize how fast we've picked up already. I mean, the fact that we only started vaccinating 3 weeks ago, and we're now vaccinating 1,000 people a week, that's a big change. And so we would assume that change will continue to occur, and we will ramp up because we need to vaccinate a lot of people every week, and the logistics are really quite amazing. So it's gonna take a while to ramp up, and it's not surprising that it's taking a while to ramp up, but I feel fully confident that we will be able to do that, assuming we have the vaccine supply.
Yes.
Thank you.
Okay. Next is David Andriata from City News.
Hi, thanks for taking my question. Just a couple to dovetail on here. You went through the list earlier, the executive, of the numbers that you know of so far that it's a best guess estimate, 20,000 plus the 1,200 plus what's happening in nursing homes, which are numbers that you're not privy to. But how many doses have been delivered here so far for distribution? Do we know that number? And a second parter to that, separate and distinct, have you run into any healthcare workers who are declining to take the vaccine?
Yeah. So I'm going to actually have Dr. Bennett might be able to estimate how many vaccines are actually in the count. I'm not sure if we have that number, but because I know you're getting at is probably the rate at which we're able to get those out.
Right.
But certainly, yes, even, we run our own, Monroe Community Hospital, have come across employees who have not yet agreed to take the vaccine. I think even in the hospital systems and in other places across the system have not yet agreed to take it. Right now, we're in the position where the demand for the vaccine is still exceeding the availability of the vaccine. So we're able to still stay on top of that and do that. But I'll turn over to Dr. Bennett, who might be able to answer more about how much is here.
Yeah, I should have a number for you. I mean, we should know exactly how many doses are here, but we don't actually. And that there's so many different pieces of this puzzle that we just don't know. We know that by the end of this week, it's likely that the hospitals will have used up their supply of vaccine, and their supply they are somewhere probably around 60% of using their vaccine. So you can imagine that's, 20,000 plus another, 10,000 or so that are going to get done this week. But I don't know that we have 30,000 doses. I can't say that for a fact because we simply don't have those numbers yet. We're just beginning to receive those data from the state. And what we hope to do in the very near future is to have essentially a dashboard that will have the number of doses that have been delivered to the community and the number of doses that have been administered to community. And we hope to make this very public and to be able to track it over time. It's really how we're going to be able to know that we're doing the right thing. But right now, this week, I think we're really getting close to being able to use all of the doses this week that the community currently has. The one exception to that is I think Monroe County just got a big load of doses, and those will probably be used over the course of the next couple of weeks.
So if I could just follow up very briefly, how do we know that if we're not sure how many doses has been delivered to our area, how do we know that we're moving too slowly? I mean, we've heard this anecdotally around the country, but how do we know that?
I think we're basing that on essentially the numbers we're getting from Albany. I'm sure you saw the press yesterday. There were errors in those numbers that we're aware of, but I think everyone is just learning how to track this issue. And it is such a big issue that, I just can't, I wish I had better numbers, but I don't have them yet.
Thank you.
Thanks, Dave. Next is Berkeley Green from Channel 10.
Thanks, Steve. A couple of times in the news conference, I've heard the word that the process is slow. And Dr. Mendoza, you specifically used the word kinks on the process. What do you mean by kinks? What are the kinks in the process right now?
Well, as I mentioned earlier, scheduling is a kink. We've got to find a way to schedule all these individuals from across a variety of sectors in our community. And we don't currently have a robust system to schedule. That's one that we're working on. I think we're going to have a better system by the end of the week. But so far, we've been able to reach everybody in these smaller groups of individuals. So EMS, for example, a very well organized group, they can essentially schedule themselves. When we talk about funeral home workers and funeral directors, again, a relatively small group we can schedule internally. But once we start getting into the larger categories, unaffiliated physicians groups, there isn't really a great organization for those. And so we're having to make a lot of relationships. We're having to develop lists of individuals that we didn't have before. And then when you reach out to chiropractors and physical therapists and other healthcare individuals, again, these are the kinks that we're still working through. And then, obviously the biggest kink will be when we get to the point of having a community-wide public clinic. Those kinks are manageable. Those are the ones that we've been planning for. And we're still in the early stages of staffing that and working on all the logistics for those.
I mean, I think, we refer to it as a kink when we're frustrated that we can't somehow solve a problem instantly. But I think that amazing systems have been put in place already. I mean, the hospitals are fully functional in terms of identifying all of their employees that need to get vaccinated. And those are large numbers of people that are getting vaccinated. And they've created their systems for getting those folks through the line and vaccinated and get their second vaccine. So lots moving, quite quickly. I think we sort of had some fantasies about how fast this would go.
Okay, thank you. Dr. Mendoza, honestly, a little bit of a left turn here for you. Yesterday, the governor dropped this 9% threshold on schools and testings. Can you help us understand what's going on there?
I have to admit, I did not follow the governor's briefing yesterday. So can you share more about what he was referring to there?
Well, I wish I could. I'm a little light on the details myself, but there's in regions where the infection rate is 9%, that schools will have to test every single student. And we're just having a hard time getting our arms around the nuts and bolts of this.
Yeah, we'll be working with the governor's office to clarify all that. I just got off a call with the schools. They are also trying to learn the details of what that means. So I think as we investigate that more, we'll have more to share.
Okay, thank you.
Great, thanks, Berkeley. Next is Penny Singer from the Minority Reporter.
Hello, good afternoon. Several people had mentioned that there are many pieces in place, but they've also said they don't know, there's not a firm timetable for when phases will roll out. What can you say about the prep work that's being done to ensure equity in the distribution so people who live in previously overlooked areas of the city can expect things that maybe they can see now happening for when it will become their turn based on their phase to get this vaccine?
I think that in all of our planning, equity is a constant consideration. And let me just give you some examples. For example, the hospitals, when they set out to vaccinate their staffs, it had nothing to do with with the hierarchy in the hospital as to when you came up to get vaccinated. It had to do with how much risk you had. And so I think at every stage along the way, we are trying to think about what is the most equal or what is the most fair way to distribute vaccine. The task force that's being put together has broad representation of vulnerable groups in our population. And the task force will be charged with ensuring that every consideration is given to equity, that no population is left behind, and that we are very attentive to the special needs of specific populations. It's not equality we're looking for, it's equity we're looking for. And I think that that's, just woven through the way we're approaching everything in this vaccination campaign.
So to follow up on that, so how will the task force be explaining that these phases are slow, the rollout is very slow, so that people are clear that they're not being left behind because of the systemic problems that have left people behind in the past? They're slow because this is just a once in a century type of thing. How does that get explained clearly so people don't say, oh, same old, here they go, promising us again?
I think we just have to be completely transparent about how we're trying to do this campaign. I think the more we can communicate its complexity, the more we can communicate its issues that we're facing. I think we just have to tell everyone this is what we're doing. And just, this is a little editorial, but when the phases were constructed, equity was one of the major considerations in how those phases were constructed. There was a National Academy of Medicine panel that did a lot of work, really focused on the equity issue. That was predominantly in response to the fact that we know that people of color have been more impacted by this particular pandemic than have white people. And as a result, those considerations about equity went into the construction of the phases from the very beginning. So I think we need to talk about that and talk about what that means. You know, if you're talking about hospital workers, you know there's a huge diversity of hospital workers, and you make sure you're not starting with the administration and the doctors. You make sure you're starting with the people who are actually getting exposed. You know, if you're talking about essential workers, we know that many essential workers are people of color, and we have to be sure that they have access to the vaccine in a way that is useful for them. I think at every stage we need to think about this. And, you know, just recently we have asked lots of questions to ensure that everyone is including equity in their considerations as they vaccinate the people for whom they're responsible.
Thank you.
Great, thanks, Betty. Next is Noelle Evans from WXXI.
Hiya. Thanks so much for doing this. And for my first question, Rochester Regional Health had mentioned yesterday that they were at 44% of their distribution. And I know we've talked a bit about kinks in the process, but I'm trying to understand a bit better. Does this include community groups that they would be? You know, what proportion of the doses would be going to outside groups, or is this specifically within that healthcare system?
Yeah, that very good question. So one of the things that happened in the original distribution of vaccine was that right up front, the very first vaccine that came to the community was for healthcare workers, and that was very clear. And then the very next distribution, which included the Moderna vaccine, Rochester Regional Health got a lot of doses for the community. URMC didn't get any doses for the community. They only got doses for their employees. So Rochester Regional had an added burden, which was to figure out how